Welcome everybody. I'm Jen Macbeth and I'm the president of the Southwest Florida House Rabbit Rescue. Are you guys having a good day?
Yeah.
So far, what's been your favorite thing that you've shopped for, heard?
Somebody said bunnies.
The what?
Somebody said bunnies.
Somebody said bunny. Exactly. It's all good. So I'm really excited because this is a very special person in my life. Dr. Tillman is one of our rescue vets, and we've partnered together. Yes, we've partnered together for years now, actually. And honestly, the rescue would not be possible without her because she does the low-cost spay neuters, which is really important for the rabbits, and like emergency medical care, and just a whole variety of things. But we're so grateful that she's here, and she's going to talk to you about some really critical diseases in rabbits. So take it away. Yay. Thank you.
All right. Hi, so I'm Dr. Tillman. Gosh, I've been practicing for about, I won't say that, for a long time. My practice varies. I've done large animal, I've done small animal, which I'm still doing, as well as exotic birds, reptiles, things like that. I'm no longer doing birds and reptiles, so don't ask me any questions about those anymore, or large animal. So our focus today is going to be on cuniculi as well as GI stasis. I'm sure you guys have all heard about those two diseases, but I just want to kind of go over briefly and help everyone just be a little bit more aware of those diseases, as well as you know, the things to look out for and what to do, when to talk to your vet, things like that. Okay. All right. So we all know that rabbits are prey animals, and so what does that mean? That means that they're not going to show you when they're sick, and they are programmed to do that in nature. The sick animals, they will lag behind, or they'll be preyed on, and they'll be the first ones to be kind of culled. That will be culled from the rest of the group if, you know, the predator sees, oh, this one is weak, this one is sick. So they are programmed from nature not to show that they're sick. What does that mean? Basically, that means that it's going to make it that much harder for you to recognize whether they're sick or not. So it's really important to pay really close attention to any changes in their life, any changes in their behavior, their food intake, their urination habits. All of those things are going to be very important to just pay attention and look for some of the most subtle signs that might show that they're sick. Any changes where you say, that's a little odd, that could be your sign that they're sick. Okay? That's okay.
Oh, go back.
Just make sure I got everything. The biggest thing that I want you guys to take away from this is that prevention matters. So having really strong husbandry, as well as nutrition and stress management, is going to help these guys in any situation. Okay. You know, these guys, pretty much, if you look at them the wrong way, they get sick, right? So just making sure that we have really strong nutrition, husbandry, and reduce their stress as much as possible. That will help improve outcomes across the board, no matter what situation or what disease that they are dealing with. All right. So what is E. cuniculi? So does anyone know what the E stands for? Say it louder.
Encephalitozoon.
Okay, very good. So Encephalitozoon cuniculi, and that's basically a microscopic parasite that will get into the blood cells, and that's the only way that it can multiply and then infect other animals. Okay, it has to be within the host cells, which means the cells have to be living. Okay. Most often it's going to affect the brain and the nervous system, but some of the other organs that it can affect will be the kidneys, the eyes. It can also, because it gets into the neurologic system, it can affect things like the back legs, right? So we want to just be aware that you might have a limping bunny. It may not just be simple arthritis. It could be arthritis plus something else, right? So we want to just kind of always keep this kind of in our back pocket as a possibility of the diagnosis of what's going on, okay? Exposure is very common. However, every pet that's exposed does not actually show disease. And we'll go over that in a few minutes here. Generally, problems will arise when these guys become stressed. And again, what causes stress in a rabbit's life? Everything. So it could be poor nutrition, it can be poor husbandry, they could have underlying conditions like arthritis, kidney disease, you brought somebody new to the house, you changed their carpet and they didn't tell you to. So anything that causes these guys stress will absolutely cause them to display signs of the disease. And I like to say it's kind of similar to people who get cold sores. You know, they get them periodically. They don't always have it. Well, we know that they have the herpes virus in their system and it goes into remission. Well, this is kind of like this, okay? It's kind of like that, rather. They get stressed and then they may start to show signs of having this condition, okay? But otherwise, they may not show any signs at all. And a majority of rabbits do not show signs, okay? It's only when they become stressed that you may actually see these signs come up. All right, and there again, so in some places, more than 50% of rabbits will actually, let's say, have exposure to E. cuniculi. It's probably higher, and why is that? We don't really test for it routinely, which is something that we may need to consider doing as a community, is testing for it more so that we know, okay, this one has a higher titer for it. We need to probably do a little bit more husbandry, a little bit more care in cleaning and things like that to try not to spread it to any that you have, you know, in your household or that you might be bringing in. And here we go again. So exposure does not equal infection and does not equal active disease. Clinical signs generally will occur only when the disease is expressed. And when do they express the disease? When they get stressed. Exactly. So the ones that are at higher risk are the ones that have chronic stress, the ones that are having, you know, maybe things like overcrowding. That will cause stress in rabbits because there's going to be food competition. So then the nutrition is going to go down, right? And you're going to also have what? Lots of pee all over the place. This particular disease does, it is passed on through the urine. So anything that, I'm getting a little ahead of myself, anything that can be contaminated with urine can potentially cause exposure, okay? Other causes like older rabbits, if they have any underlying or concurrent illnesses, things that you wouldn't think of, dental disease, overgrown incisors, they could have had an injury, inter-household fighting, all of those things, anything that will cause stress can cause these guys to actually start showing signs of this condition. Okay, go ahead and change it. So transmission pathways, when we look at how rabbits are exposed to E. cuniculi, we have to think about like the route. So what does that mean? So when they ingest the spores, which are in infected urine, that's how it's passed on, that infected urine has to contaminate the area or whatever it is that that rabbit has contact with. Contaminated bowls, water, litter, and surfaces. And the biggest factor is us being contaminated. Your clothes, your hands, your hair, your everything, your shoes, okay? So we are the kind of the biggest exposers to our own pets.
Sorry, New Bunny Mom.
Sure.
But you're talking about like their own urine. Like this can come about.
Yes, not our, rabbit urine.
Not other rabbits, but like, you know, she's a single rabbit, the
Mhm.
only rabbit in the house. So it could be from her urine, her dirty bowl. Not that I do dirty bowls.
No, it's going to come from another rabbit
Okay.
that she is exposed to. Their urine contaminated to the environment.
Thank
you. Okay. You want to try and reduce risk by having really good routine hygiene for your rabbits, whether you have a single rabbit or you have multiple rabbits, especially if you are fostering or adopting new rabbits and bringing them into a household where there's already established rabbits, okay? You want to make sure you have really, really good hygiene. And also, if you're bringing in new rabbits into your household, you want to isolate them from the other rabbits, which I know is something we don't want to do. We want them to get used to their new friends, but you do want to quarantine them for at least 30 to 45 days. Why? We're looking for them to start showing signs, right? They're going to be very, very stressed within that 30 to 45 days. They're in a new environment, new sights, new smells, new rabbits, trying to get to know them, and they may not be ready to meet and greet, immediately, or they may be, but it will still cause them quite a bit of stress, which means they can start to show signs, okay? Most rabbits are already exposed. There are other modes of transmission, especially when they're born. They can actually be exposed from the mother's urine, okay? So that's also a point of exposure for these guys when they are very young. So they can actually already have it in their system, and then they could be the ones to expose your household with your new bunnies in it, or vice versa, okay? All right. So clinical signs and diagnosis. So cuniculi generally comes in two different forms when we're talking about clinical signs. We can have the neurologic and the non-neurologic signs. So the neurologic signs are going to be that classic bunny that has that head tilt, that's rolling and spinning, kind of gator rolling. Maybe they're a bit off balance or uncoordinated. They also may just have hind limb weakness. They can have tremors. They can have seizures, right? So the presentation can be confused with other conditions. And we want to be aware of that. And always, like I said, keep it kind of in our back pocket, that when we see, go that way, sweetie. When we see a rabbit that might have clinical signs, maybe they're not the classic cuniculi clinical signs, but they could be similar. We want to make sure that we keep that in our back pocket as a part of a possible diagnosis, okay? Go ahead. And then the non-neurologic signs, of course, we've got that classic, it's not working, no. Okay, so we've got the classic lesion in the eye, but it can also look like that. And a lot of times people look at this and say, oh, they're getting cataracts. Be careful of that, right? Because it could be something different. So it's always best if you see a new clinical sign or something new that you've never seen on your rabbit or in your rabbit's eye or anything like that, you want to get it checked out immediately, okay? A lot of times if we have a rabbit that hasn't had any clinical signs and then all of a sudden something like this shows up, we need to treat immediately, okay? With kidneys, if it affects the kidneys, then we can have increased urination, increased thirst, weight loss, gradual decline in health, or, kind of failure to thrive. That sounds like it could be any other disease, right? But it could be this one too. So we want to make sure we don't just throw that off the table just because we think, oh, he doesn't have that. He's not been exposed. We don't know that, okay? Like before, rabbits like to mask their illnesses, and signs can overlap with anything. Inner ear disease can cause stress, can cause pain. We could have cuniculi underlying, okay? So we want to make sure and keep that, again, in our back pocket. Also trauma, things like that, which will cause stress, okay? Diagnosis is absolutely not easy, okay? There's no one test that will give us the answer, right? There are tests that we can do, antibody titer tests, we can do PCR, but even if we get a positive test, it does not mean that that rabbit is in active disease, okay? We can have positive tests. They're not in active disease, but they have exposure, but they're acting clinically normal. But it's always good to do that test, all right? As generally when we do the test, there is a problem there, and we are looking to see, is this present? If we do titers, where's the titer? And if we do titers, generally, or if we do the testing, generally we need to recheck that test after maybe that illness has cleared up. to see if there's any movement in that test level, okay? So it's like doing a baseline and then doing one later to compare it to the baseline, okay? Any changes in the one that we do later on will give us an idea if we had that condition that was actually active or we didn't, okay? Treatment for it, there is no cure. So please don't ask your vet, how do we cure this? There is no cure for this. This is lifelong. They will have this always once they are exposed. But generally, if they are showing active signs consistent with this condition, we will treat with fenbendazole, which everyone knows is Panicure, okay? Generally a 28 to 30-day course plus anti-inflammatories. A lot of rabbits will respond to this treatment. Their signs will get better. Some signs completely resolve. Some signs partially go away. Some signs stay exactly the same and possibly get worse, okay? So response to the treatment varies, but it's always highly recommended to treat, okay? Supportive care, depending on what signs your pet is showing, we'll recommend supportive care. And that supportive care can look like anything. It could look like fluids. It could look like assisted feeding, safe housing, because we know that with some of these rabbits, when they have that head tilt, they are rolling around in their pen. We need to make it safe for them, right? Some of these rabbits, we have to go so far as the supportive care could be enucleation of that eye on the same side as the head tilt. That opposite eye may have to be removed to keep that area safe, right? Because they're going to damage that eye. That's going to cause pain. That's going to keep the symptoms going on, okay? So that could be a possibility. That doesn't always happen, but it could happen, right? Also with this condition, I just want everyone to just have realistic goals, okay? We can't cure it, and it's a very difficult diagnosis, and sometimes it's very difficult to even render or give them supportive care. So keep realistic goals. Some of these guys are doing so poorly that we have to make a tough decision. So be prepared that that could be a possibility. It might be hard to hear, but just be prepared. We have to kind of keep that in mind, okay? I think the next one might be, yeah. I'll pause right there. Are there any questions about E. cuniculi?
When the titer comes back very low, does that mean anything? I mean, I've heard both.
Yes. So one test alone, we cannot judge positive or negative. Okay. We need to do, that's just the baseline. We need to do a second test. Generally, if we've treated for it, I'll do a second test 30 days later. And then we compare those two tests. Is either we'll get an elevation or it'll stay the same. And then we can kind of make a judgment on that. So, okay.
I remember seeing a talk. Are you familiar with Carolyn Cray?
No.
She's at UM, and she has a lab that specializes in E. cuniculi. And in her talk, she said something that really surprised me, was that when they see rabbits with the ocular E. cuniculi signs, it's never systemic. It's either or. Have you seen that too?
It varies, and each rabbit, each one is different. So it's really hard. You cannot give them all the same thing because they're all not going to react the same.
Right.
So,
but have you seen rabbits with just the ocular and then they don't have any other kidney presentations or anything like that? Because that's what she said. She's like, all of them are like that. It's either ocular or systemic, which is kind of surprised me.
Nah, I'm not sure about that because a lot of times if they're ocular, sometimes if they are stressed enough, it's going to go systemic or it's going to go neurologic.
Really?
Yeah.
Even though the eye is an immunological eye?
It can be isolated, just like the herpes virus. It can be isolated in one area at one time. So, yes. Yeah. Okay. Anyone else?
I would just say, this like sample size of 2,000, I think at this point with rabbits in the rescue. No disrespect to what Vet was saying and Dr. McCrae, but I've seen ocular and systemic both. I haven't seen an exclusive of each other.
Okay.
So I've seen ones born with the ocular, and then they will develop kidney and other things later, which is indicate systemic,
Mhm.
or vice versa. Like I'll see them develop the ECI later on in life. So yeah, I don't know.
Yeah, so it can just it can vary. So
Yeah.
we don't want to stick them in one category and say, no, you're only this. Yeah, and each doctor's going to kind of have their own experience too. So yeah, universities usually have a very specific experience, so it can be a little difficult with that. All right. So we'll go ahead and move on to GI stasis. Thank you. So GI stasis is basically a gut motility issue, okay? Either the gut slows down, so the GI tract slows down and things are not moving the way that they should, or it completely stops completely and there's nothing moving through, okay? This is actually a medical emergency. And the things that you're gonna see, so what happens, basically rabbits need to have constant fiber going through their system to keep their GI tract moving all the time. That's why the most important part of their diet is what? Hay, right? Not greens, not cookies, not pellets, not papaya. I know they love it, but primarily 90 to 99% of their diet needs to be hay, okay? And that's just the way they were made. So some of the common triggers usually end up being low fiber, dehydration, stress, pain from any source. Pain from arthritis, pain from dental disease, pain from my mate bit me, pain from anywhere. So that, and also the underlying E. cuniculi. So any underlying disease can also cause GI stasis. GI stasis is not a primary disease. It's always secondary to something else. So anytime we have GI stasis, then we have to look under the surface, like, well, what else is going on? Did you bring in a new rabbit? Anything that could have caused stress. Did you bring in a new rabbit? Did you change the carpet? Did you change the diet? Has he been sick recently? Have an ear infection? Anything like that can cause GI stasis. Okay, so it's always a secondary disease and not primary. Okay. Some of the clinical signs early on, you might just have maybe a decreased appetite, some selective eating, fewer and smaller fecal pellets. Classic. If you ever see that, emergency, please get into your vet, okay? Because sometimes that might be the only thing that you see. A lot of people don't bat an eye if their pet starts maybe just picking at the hay, eating still, but just picking, being a little selective. I just want to eat this piece of hay, not these over here. Take them in, get them checked, okay? Just to make sure we're not missing that. Later on, we'll see a progressive things like they're not pooping at all, right? They're not eating at all. Their bellies may look or feel bloated. They may grunt when you pick them up, right? Which is a sign of pain. Because at that point later on, their stomachs are just filled up with gas because nothing is moving through, nothing's moving out. It's just sitting there. And if you can imagine, just like us, if we have gas and bloating, you don't feel like eating, you feel nauseous, you're feeling painful maybe, especially if it's moving from this side to that side. They feel those same things. It's just that they're super sensitive to it, okay? And it can cause them a lot more problems. They can't take, Gas-X on their own, right? We got to help them out. They can also become very lethargic. Their temperatures can drop very low, which is life critical for these guys. So there are a lot of things, and not a lot of owners will take temperatures at home, right? So there are a lot of things that can happen. So as soon as you start seeing those very subtle signs, remember they're prey animals. They don't want you to know they're sick because they don't want, even though they love us, we're large like predators to them. That's why sometimes rabbits will run away from us when we bend over to pick them up. It's because they're afraid, right? So they are pre-programmed to not show that they're sick. So we have to look for those very, very subtle signs. Diagnosis is generally made by physical exam, abdominal palpation, and radiographs are critical. and I'll show you why in just a couple minutes. But radiographs are critical. A lot of times we like to skip doing the x-rays, but radiographs are very critical in helping us diagnose GI stasis. There are a few things on the radiograph that we can see, and I'll go over a couple of radiographs here in just a moment. But radiographs are super important for that. And on occasion, or just depending on the situation, because remember, every rabbit doesn't read the book that we're given to read about rabbits in school, blood work may also be mission critical for these guys as well, okay? Treatment, and just a warning, generally, you know, we do pain control, rehydration, assisted feeding, restoring the gut motility, but we also have to absolutely treat the underlying disease, which means we have to do diagnostics until we can find out, well, what caused this. And we could find out what caused it in the history. It could be, oh, well, I changed from Timothy hay to orchard or oat hay. Did he like it? Yeah, he ate it. When did he start acting sick? A couple days later. You know, so we may have to make some changes in how we switch them over to that new hay so that they don't have an upset tummy, right? Because again, snowball rolling down the hill, things just kind of add up. You really want to try to avoid home treatment unless you've been through this before and unless it's under the direction of your vet, okay? I know we all like to use Dr. Google. Word of caution.
For chat.
Chat GPT now, that's right. Google has some competition. So we want to be careful about using those resources, especially if we don't have, you know, input from your veterinarian, okay? They can help you decipher the information that you've read online so that they can tell you how it applies or if it even applies to your pet. All right, so here's some typical x-rays. What we typically see on the x-rays, let me see if this is gonna work. It is not, so I am Vanna White. Okay, so these are two different rabbits here. I just wanted to give you kind of a good representation of what we will see on x-rays and what makes us so concerned. So on this x-ray, you can see there's huge gas patterns there. Were you able to see that? I know I was in the way. Vanna White short, so I have to tippy toe. So here, those are very large gas patterns. That generally will indicate that the GI tract is not moving and gas is piling up in those particular intestinal loops. That happens because even though the GI tract's not moving and pushing things out to help them poop, the bacteria that's naturally found in the GI tract is still processing food and things and still producing gas. And where's that gas going to go if it's not moving out? It's just going to sit there. And those intestines are just going to keep getting larger and larger. Pain. Gas and bloating. Pain. On this x-ray, and I hope you guys can see it, this kind of looks like a fried egg. So you see this little white area here, and then you see this darker kind of area in the middle. Does everybody see that? Okay. So we do call that the fried egg appearance, and that can indicate the same thing as that one. So gas and bloating, but it's isolated in the stomach. Very painful. And usually what causes these guys when you pick them up to grunt because it's very painful, right? This can also indicate, both of these can also indicate a possible obstruction. So that is another reason why you should never treat at home without input from your vet, and other reason why we also always do x-rays. We need to know if they have an obstruction. If they have an obstruction, there are certain medications that we treat them with that are contraindicated because of the obstruction, okay? If we give those medications, basically, potentially, we can cause a rupture of the intestinal tract, which is fatal. Okay, so that's why you want to get input from your vet before you start doing any kind of treatments at home, okay? Yes.
I had like a question and comment just for those in the room. That one thing with, I see a lot in like the chat groups and online Facebook pages and things, people when their rabbit stops eating, people are saying, you know, Stardust is feeding, so we know rabbits need to eat constantly, and this is really dangerous because if you do have a true obstruction or watch the doctor remedies online to telling you what to do.
Yeah, exactly. Especially if they tell you to use something on over the counter. Yeah, please. A lot of medications over the counter that we can give or we can take, they cannot. Right? We want to be really careful about that. And Jen is right. Definitely, you want to make sure and just be careful of any of those remedies that they give you and instructions that they might give you to do home care, because it can be very dangerous. Okay? All right? So always under the advice of your vet. Call your vet. Hey, they're acting like this. What should I do? And hopefully they say, bring them in now. Okay? That's the best thing you can do. And it gives you peace of mind. Just think about it. Now you know, okay, great, they're not obstructed. We can start assist feeding. We can start a pro-motility agent without the fear that we're going to rupture the GI tract and cause more damage, right? Okay. Thanks. Prevention and when to seek help. So daily prevention, basically make sure that we are providing them with a unlimited supply of high quality hay, leafy greens, limited pellets, even the greens, limited. We're not trying to have them eat that only like the rabbit in my backyard eats everything out of my garden that's green. We don't want them, but I know he's eating hay too, but you don't want them to only have that as their primary diet, right? Greater than 90% of the diet should be hay. Reduce stress. Make sure they have a stable routine where they know I'm going to get fed at this time. They're going to pet me this time. Try to keep their routine the same. Changes in routines will cause them stress. So we want to make sure we try to keep their routine the same. Make sure that they have proper housing so they're not stressing out about, I don't have carpet today. What's wrong with these humans? You make sure that they have the things that they are accustomed to. And if you make changes, do it slowly. Okay, very slowly so that they have time to adjust and show that they are angry with you by thumping and all those things, tossing their bows, all of that, right? If they are a bunny that you just adopted, but it was a bonded pair, maybe the mate passed away, they probably need to be bonded again, okay? Because being alone might be stressful for them, okay? Slowly. That can cause stress as well. It's like, who is this new person in my I don't want them near me. So slowly introduce them to new mates, okay? Routine vet checks. I cannot stress enough. I know that they rarely, quote unquote, get sick. They need to see your vet if they're young. I would say probably once a year. Once they get to be somewhere around 4.5, 5 years old, you want to try and start taking them in at least twice a year. Let the vet lay hands on them, listen to them. There's so many diseases and problems that we can pick up on physical exam. We can pick up heart disease. That's not something that you're necessarily going to immediately see signs of in a rabbit. So you want to at least get them into the vet once a year when they're young. When they get older, at least twice a year. And do not underestimate doing blood work once a year when they come in, okay? So that we can catch things early and start treating appropriately early, okay? All right. Let's see. Oh, and you want to make sure if you see any of these signs to seek help fast. If not eating or producing feces within a 12-hour period, or it's small, they need to be seen immediately. Call your vet. Say, I'm coming in. I gotta have you look at him. Something's wrong, right? If your vet says, oh, just watch him, you are the one who has to advocate for your pet. No, I'm concerned. I want to come in today. Okay? All right? Any pain or lethargy is urgent for sure. Because, I mean, with these guys, picking up those subtle signs and immediate, quick, urgent action is critical for these guys. Thank you. Any questions? No questions?
No, just a comment.
Sure.
So she's one of my vets. We have two, everybody knows shirt. Oh, he's not here now. We have 22.
Mm-hmm.
So we learned on the fly, as you all know, and then collected the rest of our buddies from Jennifer behind us here. But one of ours, just to give a word of encouragement, Rusty, one of our geriatrics, I think it was the week before we gave him what you call that thing, the disease that's in Florida, the R.
Oh, the RSV
Yes.
vaccine.
So we gave him the RSD and things turned south since then. He got stressed, whatever. Then we noticed he was eating, but I noticed in the evening, like the day after, he lost his balance completely. And he would find, like he would fall, literally topple over. And at that point, I'm like, something's very wrong here. And then later in the day, if he wanted to, like, you know, sometimes they raise up on their front legs, hind legs in the ground. He couldn't do that. He was falling over. I said, no, time to see. I think it was you, Dr. Tillman. I don't think I was in the kitchen at that time. Anyhow, we go between the two. So took him immediately to the vet. Something's wrong. Please come and see. And we take our bunnies in, by the way, every 6 months. They're on a schedule for regular checkups because we don't like the surprises. And she treated him very nicely. As I said, treatment kept up with him. He was in stasis, we know that, but we've had enough experience. You're patient, you encourage, you pray over them if you're a praying kind.
Yes.
Yes, you encourage them, and he came around. Every now and again, he has this little twitch like in his tail, but David gives him the laser. You can talk to any of the vets around here about the laser treatment. Very, very, very effective, by the way, for pain, arthritis, and other things. So thank you very much. Rusty is still going, and he's lost 1 weight. He rebounded, and he's like a young boy.
Awesome.
Thank you so much.
Great.
I wanted to say one more quick comment, because the RHDV2 came up. So, the rabbit hemorrhagic virus, as you know, it's really virulent and it's deadly. And Dr. Tillman is right now the only vet on this West Coast offering that vaccine. Okay, and up north. Yes. So down from Naples to Tampa, and then Bay Animal in this area. But otherwise, we've lost. They're not doing it down in Sarasota, and so we've had Lake. Is there anybody in Lakewood doing it?
Why is that the only reason? Why are they the only ones that do it?
That offer it? I don't know, Donna. Have you?
I mean, we in Miami we have it.
Yeah, it's.
But why are the bunnies that you adopt from SPCA and Largo, they're vaccinated?
Well, there is a vet, and what we're saying up here, there is a vet that does it. Well, we're down based in like Naples, Fort Myers, Estero area, and she's currently the only vet offering it. So just keep that in mind. I don't know if anybody's down from Southwest Florida, but that's
some of it is education about the vaccine, and the other part is the vaccine has undergone a few changes, the way that it was delivered and things like that. And then what we just talked about, you know, some rabbits do have, just like us, have a reaction to the vaccine because of what we just talked about. Do they have an underlying condition, which vaccines stress your body, it stresses your immune system. So there's always that possibility. But honestly, the prevention is much greater than the cure. There is no cure for that. There's only death, right? And it's not just death of that one bunny. It's the whole household, right? You don't want the government to come in and take out the whole household, right? So prevention is much greater, right, of protection. So that's why I recommend it.
Thank you. That was awesome.
Yeah.
Thank you. That was great.